Another cause of pain and discomfort in the mouth is going to be wisdom teeth. Now, typically this affects a specific age range, so we're talking 16, 17, up to mid-20s. It can affect anybody at any age, so the oldest patient I think that I've had exhibiting wisdom tooth symptoms was about 84 years old, so it can happen to anybody, but when it happens it is uncomfortable, but particularly so for this younger age range. How does that present itself? Well, normally discomfort all the way back here. Now it can be top or bottom wisdom teeth, so top ones obviously up here, lower ones down here. Lower ones tend to be the ones that present with the worst symptoms. Other symptoms here, other than the pain and the swelling, discomfort underneath the lower border of the jaw, possibly radiating pain to the ear, top teeth and up to forehead. Limited opening, so we can't open our mouths quite as much as we used to be able to. Sometimes that can be quite a small amount, but often it really does close the jaws together. Sometimes people even find it difficult to get food in because the opening is so restricted. Nasty taste and or odour associated with that area as well. Again, we're starting to get food getting caught between the wisdom tooth and the soft tissue, the gum that sits around that, so things are hiding down there. In terms of trying to manage this now, cleaning clearly is going to be really important, and rinsing particularly. So we're going to use some Corsadil mouthwash, or we're going to use some warm salt water. Some people do have hypersensitivities to Corsadil or chlorhexidine that's within that, so just be a little mindful. If you do, don't use it. Warm salt water is fine. Try and do that as much as you can, so 3, 4, 5 times a day. Bathing it to start with, so don't go too vigorously around. Again, agitating the area can make things less comfortable, not more so. And brushing your teeth. Do get the toothbrush in and around. We want to try and reduce the number of bugs in the mouth more generally, but don't go clattering around back there with the toothbrush end, because that's going to bump things, it's going to bash things, and it could potentially make things, again, less comfortable, not more so. Soft diet, nothing with any edges, so crisps and Doritos and things like that are out. Spicy things similarly can make things uncomfortable because, again, it can irritate and cause some swelling. We don't want to do that. We want to do exactly the opposite. And making sure that you're sensible. So again, nothing that's too temperature hot, trying to cool things down a little bit, so ice cream is a good idea. Holding some ice sometimes in there can make a difference as well. Sensible pain relief, again, paracetamol, ibuprofen or other anti-inflammatories are a good idea. Remember, if you're exhibiting COVID-19 like symptoms, so the flu, the cough, you're feeling muscle aches, lethargy, all of those things that we all know about at this point, try and avoid ibuprofen. It can constrict down the bronchioles in your lungs and it can cause other issues with breathing. That's why asthmatics shouldn't be taking ibuprofen. Other things to remember with wisdom tooth problems is the likelihood is it will subside, it will get better, but as we've done with all the other things, keep a sensible diary, either mentally or write it down. Get in touch with your dentist to get some sensible advice over the telephone. Again, the dentists are able to offer advice, analgesics and antimicrobials if appropriate. If the infection is persistent in nature and the symptoms aren't getting better, they're getting worse over a period, then again antibiotics are going to be the way forwards here. The bacteria that tend to cause this problem don't like oxygen, they're anaerobic bacteria, and it tends to mean a drug called metronidazole or Flagyl is the one that is often prescribed in here. Alongside of others, there are clearly other antibiotics that are available for this issue as well. With metronidazole, please do remember you cannot drink alcohol with it. If you drink alcohol with it, you will be very, very poorly. And of course, as with all of these things, if you have it, I hope you get better soon.